this can also be used to respond to those outbreaks. But clearly, it's an handicap. Some countries that might not have, at this point, the capacity to mobilize those resources will be limited on actually requesting those vaccines, though they might need them. So we are also trying to support them on how they can mobilize those resources. Remember that Africa CDC recently opened position for finance officers so that they can support the countries on mobilizing domestic resources. So on the question of Carmen, so the meeting that will happen is not with the US official, but rather with the Ministry of Health of 16 countries. So following the America First Global Health policy, there have been designed 16 countries: Cameroon, Cote d'Ivoire, DRC, Congo, Eswatini, Tanzania, Uganda, and so on. Those countries will be piloting on how this new strategy that is coming from the US can be implemented as an opportunity, because we are moving from an era where we are seeing health in terms of aid, of charity, moving toward investment and partnership. So this conversation will happen this afternoon, led by our Director General, John Kaseya. That's the reason why he's not able to take the brief. So the other question was on the impact of the global health financing. I will say definitely we've seen a lot of challenges in the response to outbreak. We've been talking about the sample transportation. We've been talking about the sample collection in many countries, Uganda, DRC, and so on. We've also been talking about the HIV. That was one of the reasons why the emergency consulting group of Africa CDC mentioned that we are seeing a high number of people with HIV dying of Mpox, some of them because they don't have access to ARVs in some of those countries. So those critical element has been highlighted, and then the report that Africa CDC has been working on will be published soon with now the real evidence on the impact. But on the other hand, just mention country like Uganda, despite all that, they managed to mobilize local resource. Cameroon also has found some indigenous resource to actually address the gap that has been created by the reduction of international partners. They were not only the US government, as we all know, to ensure that they protected their community.
Thank you, Prof. Let's go to our third part of questions, this time focused on Mpox. We'll take these two. The first one here says is from MODERATOR. He's an editor at Rwanda Dispatch, and he writes, what are some implications of Mpox outbreak on wildlife conservation hotspots areas? That's our colleagues from Rwanda Dispatch. And the second one said there have been reports of rising Mpox cases in Addis Ababa or in Ethiopia. Has Africa CDC received any official information from the government so far? This is from Adesa Getaju from our Q&A section here. Over to you, Prof.
Yes, the first one was, I think, Amiibo. I didn't get properly the name, but I think that's the one. So from our colleague from Rwanda, the implication of Mpox in wildlife conservation area. I think this is a very good question, very good, because this highlights the importance of the One Health approach. And part of the beneficiary, the implementer of the pandemic fund, which is the money that the World Bank and other partners brought together to support the preparedness and the response to pandemic, an important part has been dedicated to the One Health approach. So the FAO is the implementing partner that is handling that with another, which is really focusing on the area of Rwanda, DRC, where we have the wildlife to ensure that they are protected. So the impact actually, I will say, can be a positive one in the sense that it attracts some resources so that we can strengthen the surveillance, because usually when we look at the surveillance, we look at community healthcare workers on the side of human, but this time it's also including community health workers on the side of animal surveillance, also including the strengthening of veterinary lab, as we've seen in Rwanda, we've seen also in Burundi and in DRC. So I think it can be seen also as an opportunity to strengthen the One Health approach and the building of that capacity. So for the Ethiopian situation, as currently we have 28 cases that has been reported with one death, if I recall well. Currently, as we are in Accra, we have the colleagues from Ethiopia. There are 3 of them from the Ethiopia Public Health Institute. They've presented the data. They've also presented how they've managed to respond in a very holistic way to the Mpox outbreak, leveraging on the different campaign, the polio campaign that has really allowed them to have the mass surveillance, which is not always easy to implement. So actually, it's a good experience that has been shared